Okay, you can tell me when you want me to start.
We already started.
You've already started?
Yeah.
My colleague said to me, why do you want to be a community nurse? And I said, well, because I want to be able to spend more time with my patients. I want to do a varied job. I don't want to be on a ward, the same ward every day. I like planning my day the way I want.
It's helping people. It's making a difference and making sure people that want to stay at home are able to stay at home.
We do see patients from 18 to the grave.
And we do any kind of care that requires a nurse.
And you couldn't really look at what's on your piece of paper and predict how your morning's going to go, which is probably why I quite like it.
And although I'm doing something which probably isn't very nice, which might hurt, or, you know, they still enjoy seeing me. And that's why I wanted to be a nurse, because I wanted to make people happy. I might cry in a minute. Bill? You here? Hello, Bill. There we go.
I'll be all right in a minute.
Head up, bum in. I don't want to just go in and look after someone's wound. I'm looking at where they're sleeping, what they're eating, how they're mobilising, providing them spiritual support if they need counselling. You know, I'm seeing the whole picture that could be affecting their healthcare.
When I start kicking.
Don't you kick me?
No, I will do, though. That's the trouble when I lift my leg.
Woo!
I can't stop it.
It's all right, don't worry about it. I only went to the gym yesterday.
You started me off now, big time.
So I've in district nursing now, probably 23 years. Wonderful, love it. Absolutely amazing. Okay, come on.
Give it a chance. Well, to me, it's been a lifeline. It breaks your day to have someone come in that door, especially when you're very poorly.
Oh, Shirley, your tummy's misbehaving again.
Oh no. See, to me, we're like friends now, aren't we?
We are.
So, she torments me and vice versa.
We in-reach into both hospitals to vulnerable adults. So anyone who is street homeless, sex working, asylum seeking, and more recently gypsies and travellers.
Okay. So we have a bed for you at the crypt, and we'll catch up with you in the morning, and we aim to come every day if we can and touch base with you and see what we can do to support you.
That's our primary contact, is when people are admitted to hospital. But that doesn't mean we won't stop and talk to people who we see when we're walking across the city. It's getting cold now though, isn't it? You know there's a homeless practice down the road.
You know. But I think everybody is somebody's somebody. Everybody is significant to somebody. You know, they're a person, and people deserve to have a chance. And and I feel privileged to be able to do that.
I met a nurse who said, why don't you do nurse training? I thought, it's all women, and I'm not young anymore, and also I can't afford to do it because I have to be a student for 3 years. Well, for each one of those she said, well, that's not true, and you'd be good at it. So I did it, and here I am now. I've just finished my training and I'm just starting my new job. It's my first week.
It's a great job, but it does come with its very own, with a lot of responsibility, working autonomously, so you are every day making decisions regarding patient care and treatment. Yes, there are parts of the job that are tough, quite emotionally, because we are dealing with patients towards end of life as well. But we have fun days, like today we go to an exercise class, and it's not all doom and gloom. Right at the top end of your heart rate target, which is fantastic.
Yeah?
Yep.
Oh, good stuff.
But working in the community is been a great move for me, fantastic. It's, like I say, it's opened up so many more learning opportunities.
I've not only developed more since I've come to the community than I ever did in hospital, I've got a lot more skills than I ever did. It's completely changed my perception of district nursing.
See you. No, they're not just nurses. They'll come and sort you out with whatever problem you've got. They've got the answer.
Often the perception of people working in a hospital is if they move into the community, we don't use advanced nursing skill, but we use every range of nursing skills that you can imagine. The most important one is communication, but everything else, so injections, nasogastric feeds, intravenous drugs, assessments, advanced assessment skills, prescribing, leg ulcer care, long-term conditions care. It's a place to learn. It's a really good place to learn.
Make sure that it doesn't catch on the other bag, but just on the tip of your finger, just use it to go round. Yes, brilliant. So sometimes the nursing aspect is not what is worrying the patient, it's the psychological aspect. So when we do holistic care, we're taking in consideration the whole person.
So we can talk to you about it more than I can, the family, because they don't.
Too close.
Yeah.
You know you can talk to me. Go on. Fire away.
Oh no, I mustn't.
Yes, you must. Go on.
Yes, Marcia talked to me about memory boxes. It's just something I need to do because we have a 13-year-old son. So I'm unlikely to be here for his 14th birthday. So we're talking about what we can put into that and how to do that. So it's not just clinical, not just medical. The most salient point that stuck in my mind from that conversation yesterday was that she said, remember, a memory box is not just about you giving to others, it's about for you receiving from others. Which took me to a nicer place. And that's district nursing.
I wouldn't want to do anything else. I wouldn't want to do anything else. I get up in the morning and I'm ready for work.
I think it's a grand job and there are lots of different community nursing jobs out there, whether you want to specialise or not. I would never discourage anybody from working in the community.
And that we keep a lot of people out of hospital because we pick up on things quicker, because we know patients so well.
I love my job. I don't think there's any job quite like nursing in the world.
It is. Sometimes I think, oh, I'm a bit sad. How's that? I've been doing this 35 years and I still love coming to work. But I do.
And if you're like me and you want to spend more time with patients and do what we're trained to do, which is deliver holistic, compassionate care, then community nursing is by far the job for you. It's like an advert.
What do you think of the district nurses when they come in?
Lovely.
They are lovely, aren't they?
Absolutely brilliant. It's like having another friend.
So it helped me a lot, actually.
They are lovely.
There need to be more district nurses. That, you know, we need more. So if you look at the health service, this is called primary care. We can't manage without hospitals, but absolutely you can't manage without district nurses.